Very good afternoon to everybody. Myself is Dr. Nirupama Singh. I will present on dietary management of patients with compensated cirrhosis with obesity, sarcopenia and diabetes. What is the definition of compensated cirrhosis? Compensated liver cirrhosis has no symptoms, no ascites, no portal hypertension, no variceal hemorrhages, no hepatic encephalopathy and no jaundice. So we can say compensated cirrhosis is better than decompensated cirrhosis. Causes of nutritional deficiency in compensated cirrhosis is reduced intake, nutrient loss, malabsorption and altered metabolism. Dietary principles of compensated liver cirrhosis with obesity and diabetes. Calorie intake should not be more than 20 kilocalorie per kg of ideal body weight. 1 to 1.2 gram per kg of ideal body weight. Protein should not be less than that. In fact, 20% of total calorie and preferably PUFA and MUFA. Carbohydrate 55 to 60% in all cases. In diabetes, if patient is not obese, 30 kilocalorie per kg of ideal body weight can be given, and if a person is diabetes with obesity, then it should not be more than 25 kilocalorie per kg of ideal body weight, and protein remains same for in all cases. Earlier we were thinking it was the concept that protein should be in less in cirrhosis, but protein should not reduce less than the 1 to 1.2 gram per kg of ideal body weight. BMI classification for ACLs is if a person's BMI is less than 18.5, it is underweight. Normal range is 18.5 to 22.9. So we have work on it. If a person is having obesity, that may also cause the liver cirrhosis. A weight loss strategy in compensated liver cirrhosis is very low calorie diet, that is 800 kilocalorie per day, is advisable under the supervision for morbid obese patient for 6 to 8 weeks, but it has to be very supervised precisely, because patient may get some symptoms also. Adequate amount of protein, not less than 1.5 gram per kg of ideal body weight. Adequate micronutrients, may require supplements. Fiber to avoid constipation. Adequate feed after assessing edema, ascites if present, not because of liver cirrhosis but for other diseases also. Inadequate food knowledge, preparation skill and food insecurity can impact the dietary intake. How to prevent the complication of the disease? That is medical nutrition therapy of cirrhosis with diabetes. Patient if coming with diabetes and cirrhosis, sometimes medical nutrition therapy only works. Sometimes it requires medical nutrition therapy plus oral hypoglycemic agent, and sometimes it requires medical nutrition therapy plus insulin. So medical nutrition therapy in all cases is compulsory. What is the strategy? That is complex carbohydrate, low glycemic index and low glycemic load foods, high fiber, low sodium, polyunsaturated fatty acids, monounsaturated fatty acids and omega-3 fatty acids as a fat substitute. High biological value of protein that include branch chain amino acids. Sources of complex carbohydrate are whole grain flour, चोकर वाला आटा, छिलके वाली दालें, सभी फलों का इस्तेमाल करना, और किसी भी रूप में लेग्यूम्स या पल्सेस का प्रयोग हमको किसी न किसी रूप में खाने में जरूर करना है. दैट इंक्लूड कॉम्प्लेक्स कार्बोहाइड्रेट बिकॉज इट कंटेन्स फाइबर ऑल्सो. सिंपल कार्बोहाइड्रेट लाइक चीनी, मिठाइयाँ, गुड़, शहद, गन्ने का रस, फल का जूस शुड बी अवॉइडेड इन ऑल केसेस. फाइबर रिच फूड like all fruits, vegetables, legumes, pulses, roots and tubers, all these things contain high fiber, soluble and insoluble fiber. So fiber plays an important role in managing diabetes as well as in liver cirrhosis. If patient is having obesity, that it may work to reduce the weight, and it will be helpful not to get the constipation also. Glycemic index is a number from 0 to 100 which represents the relative rise in the blood glucose level level after 2 hours consuming the food. Low glycemic index is 0 to 55, medium glycemic index is 56 to 69, high glycemic index is 70 to 100. So high glycemic index food should be avoided. Sometimes it happens if we are mixing the high glycemic index food and low glycemic index food with together, that will work as a medium glycemic index food. Effect of glycemic index on food. So this is the list for low, medium and high glycemic index food. So all fruits, soybean, pulses, legumes comes in a low glycemic index, and grapes, brown rice, wheat roti, which refined wheat roti, green peas, honey, it contains medium glycemic index, and high rice, as you can see, white rice, potato, watermelon, pizza, French fries. But I would like to comment on watermelon. Watermelon glycemic index is very high, but the glycemic load of food is number that estimates how much the food will raise a person's blood glucose level after eating it. The formula is glycemic index into carbohydrate upon 100. So the carbohydrate in watermelon, for example, I am just telling, glycemic index of the watermelon and the glycemic and the carbohydrate of the watermelon is 3. If we'll divide it, it will work as a low glycemic index. So watermelon can be taken, but the amount is very important. How much amount of food you are taking, that will responsible to raise your blood sugar levels. Include whole grains and cereals in the diet, whole pulses and legumes, all types of vegetables, all types of fruits, milk and milk products, non-vegetarian food product, if person is non-vegetarian, can be taken with less spices and less salt. Oils and nuts should be included in the diet. For diabetes per se, we can say angur, aam, kela, these fruits should not be taken on daily basis, but definitely once in a week can be taken in a specific amount. But amrood, seb, papita, nashpati, santara, jamun, these fruits can be taken on daily basis, and 1 to 2 fruit, 100 to 200 gram fruit is mandatory to include in the diet. This is a diabetic diet menu. If a person is having 171 centimeter height and weight is 111 kg, ideal body weight should be 64 kg. The calorie requirement is very high if we'll calculate with the present body weight. But with the ideal body weight and with the diabetes, should not be more than 1300 to 1400 kilocalories, and protein should go 60 to 65 gram per day. Cirrhosis with sarcopenia refers to the state of decreased muscle mass and increased fat mass. The prevalence of sarcopenia in patients with cirrhosis ranges from 30% to 70% in liver diseases. Dietary management in sarcopenia is calorie should not be less than 35 to 40 kilocalorie per kg of ideal body weight. Protein should increase, that is 1.2 to 1.5 gram per kg of body weight. Fat should be 20 to 30%, and carbohydrate should be 60 to 65% of total calorie. Sources of protein is vegetable and animal sources, dal, rajma, chole, chana, and animal sources in milk, paneer, dahi, mattha. Iske saath saath fish and chicken can also be taken. PUFA, MUFA and omega-3 fatty acids. So refined oil, mustard oil या olive oil किसी भी प्रकार से, and dry nuts if we are using, that will give you the ample amount of polyunsaturated, monounsaturated fatty acids along with the omega-3 fatty acids. Saturated fat should be avoided, that is desi ghee, butter, makhan should be avoided, and it contains salt and preservatives also. So it is better to avoid butter, but sometimes ghee is our part of food, so it can be taken in very less amount. Individualized diet prescription should be provided to all patients with cirrhosis or frailty of sarcopenia. Reassessment of nutritional intake should be repeated at regular intervals. If clinical deterioration or lack of improvement occurs despite target calorie and protein intake, other causes should be considered and the nutritional prescription should be refined. Elimination of alcohol and smoking will help to improve the disease. daily walk 45 to 60 minutes, Surya Namaskar, yoga and meditation. Everyone has to do at least 3 to 5 days in a week, yoga and walking or whatever exercises you can do to improve your quality of life. Methods to improve immunity. Immunity cannot be improved in a day. So for this, one has to take a balanced, healthy meal that you can see on thali. All the food groups, dal, roti, sabzi, dahi, salads, everything should be included in the diet. At least one meal should be like this, and other meals will be the combination of the food groups. Stay hydrated, de-stress yourself, do exercises, and balanced sleep is mandatory. Avoid fasting. For diabetic patients, it is better not to do the fasting. Small frequent meals is very important to avoid the nocturnal hypoglycemia. 3 major meals and 3 snacks mid-morning, evening, bedtime snacks is mandatory. To minimize nocturnal hypoglycemia, bedtime snack is necessary. Choose low glycemic index food, avoid smoking, increase fiber-rich food, avoid fruit juices, fresh or packed. It is better to take fruits, not to take fruit juices. Achieve healthy lifestyle, take appropriate sleep. Food and nutrition tips. Prepare homemade. It is better to take the homemade food. Limit your salt intake for everybody, whether person is having blood pressure, diabetes, liver cirrhosis or not. A normal person has also to decrease the salt intake. Limit your sugar intake. Limit your fat intake. Balance sleep. Daily exercises. Stay hydrated. Try to avoid outside eating. Thank you so much.